There's a lot of talk these days about the HCG diet. What is it and how does it work? We took a trip to Highland Pharmacy to find the answers. Good morning, Dr. Roland and Marcia. How are you?
Fine, thank you.
It's always great to see you, and I understand today you have a very special guest.
Yeah, so this is Marcia Hefker. She's a certified family nurse practitioner.
And we'll be discussing HCG, which is a really hot topic these days. Explain to our viewers what HCG is all about.
HCG is an acronym for human chorionic gonadotropin. It is a hormone typically known as the pregnancy hormone. During pregnancy, the fat from the mother is mobilized and sent to the fetus to help it grow.
And so that in return can help somebody trying to lose weight.
That's correct.
That is not pregnant.
That is not pregnant. In the 1950s, a researcher named Dr. A.T. Simeons used HCG in small doses in non-pregnant women and men and found that the effects were the same. Fat was mobilized and people lost weight. He further found that if you were on a restricted diet, restricting calories and fat, that there was a more sustained, more drastic weight loss.
So tell us a little bit about your background and how you help people administer or use HCG correctly.
Well, I'm a family nurse practitioner, and I have been using HCG with my patients for the past 8 years. And currently I'm using HCG with a company, Luma HCG, and we only specialize in HCG weight loss.
And what has been Highland Pharmacy's experience and role in HCG distribution here?
So we actually do supply the HCG injection and topical preparation to Luma. We've actually been dispensing the HCG for over 3 years with really great success for our patients as well.
Okay, so I mean there's so much to learn about the product, but let's talk about side effects because people do tend to be skeptical.
Well, HCG is controversial. HCG is FDA approved, but we use it off-label, which is completely legal, but it is off-label use. So we're using 60 years of experience. There are numerous research studies going on with the Metabolic Institute currently. Some patients have had nausea, headache, and some dry skin.
And also, things have changed from the 500-calorie requirement.
That's true. A lot has changed in 60 years. And we find that the normal diet that we place patients on is a meat, a vegetable, and a fruit. The fruit and the meat are proportioned, but the vegetable is unlimited.
Okay. And do we need a prescription, Dr. Roland, or can this be just bought right over the counter? How does it work?
Right, so absolutely. This is a prescription-only item. The products that we're seeing over the counter and online are usually counterfeit products that usually don't contain HCG.
So to really get the pure form of HCG, you have to come to a clinical setting, right? You can't just go to a retailer.
Absolutely, and the clinical settings that write prescriptions and monitor the therapy are usually what works the best for people.
And why is it that we can only find HCG through these avenues? Real HCG.
Because it is compounded only, prescription only, and you do need to go to a really good compounding pharmacy because sterile product has to be made in the clean room, and so not all pharmacies are able to do those kinds of things.
And you can do that here.
Absolutely.
At Highland Pharmacy. Thank you so much to you both.
Thank you.
Thank you.
If you're interested in learning more about the HCG diet, you can contact Luma at 888-7592 or visit them at 6565 Americas Parkway, Suite 200. And the pharmacists at Highland Pharmacy can also give you useful information. The pharmacy is located at 717 Encino Place Northeast.